Hey, what is up, everybody? So I am super, 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 super excited because I have my girl from another mother. You guys already know who I am. Welcome back to my channel. This is Tamisha, also known as Miss COTA, and we have a great topic for you guys. We're going to be talking about the difference between a COTA and a PTA and which route you should take. So without wasting any time, I'm going to introduce my girl. Her name is Khadija Super. She has been in the game now for like over a decade. She got so much experience. She works in rehab, primarily in skilled nursing, but I'll let her get into that. She is experienced in geriatric, orthopedic, balance disorder, as well as post-operative rehab. And she's going to explain all of that. But what I like to do, Khadija, and welcome, Khadija, officially.
Thank you so much. Thank you.
So what I like to do is I like to ask everyone, what is your why? Like, why did you become a PTA?
Okay. Yeah, so my why started years ago. I was actually in a whole different career path, and I spoke to my dad because he's been a police officer and worked in EMT for many years. And he introduced me into the field. And after doing some research, I'm like, I really can get into this. Number one, at that time, I looked at the longevity of it, and just in addition to just helping others.
Mm-hmm.
And so once I did, got introduced into it, and I applied for the program. It was just history after that. So
Okay, well,
yeah,
that's what's up. So let me
yeah.
ask you this. So you decide to go after being a PTA, right? So what was the educational requirements for PTAs? Because I know for like COTAs, it's close to like 2.5 years. Is it the same for PTAs?
Yes, it is. 2 years per se. You will have to complete all your prereq courses. A lot of times, for me, it took a little bit longer because, again, I'm trying to figure it out. But again, the program itself is usually like 5 or 6 semesters. And so once you get your prereq courses in, if anything additional that you will have to take, then you will apply for it. Well, before you even apply for it, you have to take an entry test.
Mm,
And,
okay.
and that's amongst like the overall, like the medical and healthcare students. And once you score a certain amount, then you'll be able to.
Oh, I think I'm losing you here a little bit. So I'm sorry about that, guys. We had a little technical glitch, but we are still with you. So we're going to continue. So I'm sorry about that, Khadija. You were talking about the educational requirements. You said it's like close to like 2 years.
Yes.
Yeah. So let me just ask you this, because we kind of got the brunt of that. Um, when you started working, right? How was that relationship with the PT and yourself? Did you have like good supervisors, or were they a little difficult? Like, how was that relationship? What should someone expect when they're getting into this field as a PTA when they're dealing with a PT?
Yes. Oh my goodness. My experience was amazing. I had really good supervisors, and they that let me get more creative, which was one of the things that I really really love about this profession is that you could be so creative and in anything that comes your way. More so, my specialty is more is orthopedics, which I love. Hip replacements, knee replacements. So once the PT established the evaluation and their goals, I pretty much go in, and so it's like an array of treatment. So you have like therapeutic activities, therapeutic exercises, balancing, gait training, neuro education. So I to go in, choose whatever I would like to really zone in on, and then just be creative to just bring them to the finish line. So my relationship with all my supervisors, I learned everything. I want to say every little bit of their aspects of things, put it and incorporate into my own clinical treatments and things like that. So it was amazing, amazing relationship.
So do you feel like it's a little more hands-on for you with a supervisor, or do you feel like having that PT supervisor is kind of like hovering over you?
Absolutely not. Initially, actually, they want you to be creative. They want you to be independent.
Mm.
However, they do on you, especially as a new grad. You're so unsure, you're scared, you're afraid. And once you get the experiences, I want to say within like 3 years or so, you just go in and just be a thing. It's like,
Wow. So let me ask you something, because I know you said you had a wonderful experience, but I
right.
know it wasn't the same for me as a
Yeah.
COTA. I'm not gonna lie. So let me
Right.
ask you this question: what has been like the craziest experience you would say that you had with a PT?
Oh, wow. The craziest experience. Let's see. Wow. Um,
You don't gotta say no names.
yeah, yes. I guess for the most part, it would go back early on, so that just being a new grad and just walking into the hospital setting. And of course, everything in a hospital setting is fast paced. So, I was just handed a list of patients to see, and I had not a clue. I was so scared. I was so afraid. And at that time the PT was like, okay, here's your caseload, pretty much good luck, good luck. And I was so nervous. Again, I didn't know anyone, so I didn't know who to go to. And I'm like, okay, I had to really step back, go in the bathroom and really woosah, because I'm like, I did not know where to even begin.
Mhm.
So with that said, everything worked out good. Thankfully, I had a really good after graduating. I stayed in touch with a lot of other PTAs and even my professor at the college, and just like, hey, listen, I have this situation. Can you help me out?
Mm.
So, needless to say, that PT eventually retired. After a couple of years. So at some point, he was just maybe just over it, but I was able to manage, and actually it actually built character for me as well, and just built up my confidence as well, because just just entering into that field again is scary, but if you're able to pull it through and all the patients are well and do not complain,
Mhm.
that was also is an experience. So
So you worked in multiple settings, right? Because I know, like,
yeah.
for my audience know that, like, my bread and butter,
Hmm.
my specialty is like geriatrics. I love my older adults, but
Right.
like, you worked in like, what other settings did you work in other than the skilled nursing facility setting?
Yeah, so started off in a hospital setting, very busy hospital in New Jersey, and then from that I went to a privately owned private practice or outpatient practice, and that was actually a different experience, totally different from acute to outpatient to subacute, which would be more a nursing home setting.
Mm,
So the outpatient was so chill. I was able to do more hands-on in an outpatient setting, where like with modalities, and
mm,
people came in for a lot of like work compensation and pain management. So I was able to really get the bulk of my understanding of how to treat pain through outpatient. It's
okay.
got more hands-on, yeah. And you can actually, you will see a result, in time, goes by. And compared to subacute nursing home, it may take a longer time for you to see, a difference or a progression in the patients or the individuals. However, for me too, I love geriatrics as well. That's where I spend most of my years working in that aspect of rehab.
So do you feel like skilled nursing facilities are a little more fast paced than outpatient?
It is. Well, you know what? It's a combination of the two, because for me, outpatient, you have the patients who will arrive. They're pretty much independent. So they come in like one after the other,
Mm,
With them, however, you're able to, is more carryover, because, they're there for a reason, very specific, like, hey, I have pain here. And you have to really target that area of pain and just treatment. So it's a little, and then sometimes, it does increase the pace as well, because you have like sometimes outpatient close at 8 o'clock at night. So you have the patients coming back to back to back. Versus in subacute, it's a fast pace. However, you're able to control your schedule. So in subacute, you pretty much will go, get the patients, or you have a rehab tech bring the patients to you once they're ready. You can control it better, but with outpatient, you just have to be ready. You cannot send them back home or anything like that. You just have to be ready for them. So,
yeah.
yeah.
So for all y'all that's interested in outpatients, just know that sometimes people gonna show up on their time, not
Yes,
your time.
exactly. We have to treat them too. So,
So I like that you brought that in. So let's do something. This just to kind of clarify the difference between a COTA and a PTA. So I'm gonna
mhm,
give us a scenario. So let's say we both have the same patient, right? And we're
mhm,
in the skilled nursing setting because that's like where we spend majority of the time. And let's
right,
say we both have a hip replacement patient, right?
mhm, right,
So I would love for you to say, like, what would your treatment look like for that patient as a PTA? And I'll just kind of describe like what that treatment for a COTA myself would look like for the same patient, just to kind of give people a understanding of like the
right.
two disciplines.
Yes. Yeah. So once the PT does evaluation, we have a consultation. Him or I, or she and I, have a consultation with this patient, just the overall picture of the patient itself. So, and what the precautions, number one, you definitely want to go for the precautions, the type of surgery, is it interior, posterior, whereas the patient will be limited and certain movements cannot flex beyond like 90 degree, no hip abduction, things like that, positioning. And then once, we walk into the room, however, my I primarily will start with isometric exercises.
Hmm.
So it won't be too aggressive because again, they're in a lot of pain.
Hmm.
So for us, PT, of course, the patient have to have more pain management. So that would be communication with the nurses. Okay, what time this patient got the medication, pain medication, and then we work, around that schedule so they be able to tolerate more. So
Hmm.
again,
So
once
what
the
would like an intervention look like? So what would like a
right.
basic, like what is the key things that you'll be like working on with this patient, like in a day-to-day basis?
Right. So for me, it'll be more isometric exercises and then going more manual exercises, meaning we'll start them off like with leg raises, exercises to target the hip muscles and to support the joint itself. And then from that, we'll go into active assistive, range of motion, meaning that I'm more hands on with them. And
Hmm.
then, eventually active range of motion. And then with the active range of motion, meaning they can complete it in like I want to say like a full of a range. And
Hmm.
then once we establish that, we'll go into the progressive resistive exercises where we give like weights, start off with 1.5 pound weight, 2 pound weight. So we'll have them do leg raises, manual resistance, just again, ankle palms with resistance. And then from that point on, we go into like the standing, how much they could tolerate in the standing
Hmm.
with a walker, whatever we feel that would be the best for them. And then from standing, we'll go into gait training, meaning taking steps, balance, and coordination is also incorporated into that. So our main goal is to get them almost like, from crawling to standing and then to walking eventually. That's our progression. And
Hmm.
then from that point on, once we're able to get them walking, then it's pretty much okay. Reduce the level of assistance that you are providing for the patients.
Okay, so just for you guys out there, so pretty much it sounds like with PTAs, it's more of you're focusing on like exercises and
Right.
balance and pain control, right?
Yes,
So
engage.
so for the CODA, um, so our treatment is going to look a little different. Like we're going to be focusing on how to help this person live their life again with this particular element. So we're going to be looking at teaching them how to use adaptive equipment to dress themselves and not go against their precautions. We're going to be teaching them how to get out of bed safely to or from the wheelchair to the toilet. So we're going to be our focus is not going to necessarily be exercises because we're going to leave that for the PTAs.
Mhm.
But we're going to be working on can you brush your teeth standing, right? So the PTAs are going to be working on what we call stand tolerance. We're going to
Mhm.
be working on their function during their stand tolerance.
Right.
So just so everybody can understand the difference between the two.
Mhm.
So let me ask you this, right?
Mhm.
You don't have to say how much you make, but
Okay.
if you can give like a range, because this is a big question. People want to know, well, does CODA make more? Does PTAs more? Like, what would you say
Mhm.
for, I would say maybe coming in? to
Mhm.
school, coming into the profession as a beginner, what kind of pay range should you expect?
Right. So, initially as a new grad, I would say, to be honest with you, maybe like 44K starting off, and then it ranged up into maybe 62K. But however, that range is, based upon like the experience, what area that you in. Right now, I'm currently in Georgia.
Mhm.
So, New Jersey is, the East Coast is much more higher rate. And like more so like New York, New Jersey, more East Coast, and where compared to being in another state. So,
Mhm.
and then again, experience, the area's experience. And again, I will always say or recommend if you have like an area expertise that you want to continue to do, like cardiac rehab, these are also things to be able to negotiate at the table when you're looking at, different companies as well.
Okay, so you're thinking like maybe between like 22, 26 to start off with? You're thinking?
Yeah, maybe for the most part. Yeah, for the most part, 23, 24, maybe 24, 25. So for the most part. Yeah.
Yeah, that's pretty similar for quotas as well, guys. Just so you guys know, like we're kind of signed off of the same run here
Yeah. Yeah.
until you start like specializing, and then you get the
Right.
years of experience to kind of back you up, which is
Mhm.
like key. So let me ask you this: what
Mhm.
would you say has been the most challenging thing as a PTA?
The most challenging thing for me, I would say more so, and especially now in the COVID era,
Mm,
for me, it's just the caseload of it, and keeping up with demands of the productivity, your documentation, and also wanting to provide quality care for your patients. We have a certain amount of timing with patients. And again, you have a list or schedule of maybe 12, 13 patients a day, or it could be less. That all depends on your setting, where you are. Obviously, home care may be different from subacute or nursing home compared to outpatient. So everywhere it's different. And again, to go back to the pay rate as well, the pay rate also depends on the setting that you're going into as well. So yeah, that's the most challenging. Again, just making sure, because again, ultimately our goal is to progress our patients, and
mhm.
you want to do that the best way you can with all the, expertise that you have. So again, and then again, on the flip side of it too, we have how would you say it, like a business aspect of it as well. You know
Mhm.
what I mean? So just making sure that you are pleasing your patients, and also answering to that the owners and things like that, because again they want to make sure that things are aligned as well. So
Mhm. So it sounds like time management
yeah.
and
Hmm.
documentation, right?
Absolutely.
Finishing that documentation while working in time management is like
Mhm.
is most challenging. So
Yeah.
you mentioned something which is interesting, and I'm sure people are going to want to know. So
Mhm.
how is life right now? Because I know things was a
Mhm.
lot different pre-COVID,
Yes.
and then while we
Mhm.
were in COVID, and now we're kind
Right.
of coming out of COVID, like how
Right.
between those three different like genre of time, like what would you
Mhm.
say, or how would you say we changed from like pre, then
Mhm.
during, and then post COVID? I mean, we're still in those COVID
Right,
rules and
right.
regulations, but how would you say that transition in
Mhm.
that time period has been?
Right. Oh, huge. For the most part, just spending time alone, going back to time management as well. We see patients as well. Every patient is considered to be, for us, a potential risk of having COVID, because we don't know. It's so many changes have happened within the past 2 years. So we go in again, time management, meaning that we have to make sure we have masks on,
Mm,
face shields. We have to, if someone is under investigation, so to speak, or they feel like this patient may have COVID, we have to gown up. So that's another aspect of doing that just for one patient. And sometimes that can take a good 5 minutes just to prepare to
mhm,
go and see a patient.
mhm.
Again, that also may affect your productivity within the day.
Right,
Because once you finish that, then you will have to go and, um, do your documentation, so to
right,
speak.
right.
So yeah.
So I
Mhm.
know like before COVID, everything was good. We was able to run our groups,
Right,
and all
exactly.
that stuff. Are you still doing groups in your setting? Did they bring
No,
that back? It's still on hold, right?
it's still on hold, yes.
Okay,
Yes.
okay.
Mhm,
And are you guys, I know again during COVID time, like when it was really progressive,
mhm.
people would have to be in quarantine for 14 days. Are they still
Yes,
quarantining 14
absolutely.
days?
Not 14 days. They change it
Okay.
some often, but right now we have 10 days. At first they cut it down for 5 days. Now the guidelines like 10 days.
Okay.
So yeah, so those who are like who have COVID, we usually see them. We have to arrange our whole schedule to see those patients last. So
Mm,
we'll see all the patients who not at risk, you know, no symptoms. We see those patients first, and then midday we see the patients who may be under investigation or may show signs of COVID but not testing. So we see those like midday, and then those who actually are COVID positive, we see those group of people last, and then at that point we exit the building.
okay.
Yeah.
Okay.
So yes, it's we manage it, but it's tough.
So it sounds like we're still in it.
Yeah, yes,
We're
yes, we
still in it.
are.
We're still in it. While the outside world is walking around without masks, we're still running
Absolutely,
around with all this hot gear on during the middle of
absolutely.
summertime. But I think that was
Mhm.
really informative. I hope that
Thank
this
you.
was helpful for all the viewers and people that are thinking about if there should be a PTA or a COTA.
Mhm.
So just like a quick recap.
Right.
COTAs is very holistic therapy practitioners. So if there's something wrong with someone, we're working on the whole person, not just a specific area.
Right.
Whereas like PT, and Khadija, feel free to jump in, where PT is a little bit more specific. Like if you have a
Mhm.
messed up arm, we're gonna work on getting that arm stronger, right?
Yes, yes.
So that kind of lets you know which avenue you're going, especially with codas. Expect to see bodily fluids that might not be yours quite
Right.
often. A
Mhm.
couple of naked bodies, depending on the setting. I'm talking for
Yes.
skilled nursing. If it's outpatient, it might be different. Like if you're in hand clinic or pediatrics, that's a whole different scenario for a whole different topic. But real
Mhm.
quick, before we end off, because we're about to end off, what would be your advice for someone considering becoming a PTA? What would be your biggest takeaway and advice for them?
Wow, takeaway advice. I would say go for it. It's just so rewarding. I feel that we are the professions that really go in and really spend the most time with the patients because number one, the doctors sometimes are in and out, the nurses are in and out. So we collectively just go in and just really spend that one on one with patients for like 30 to 40 to 60 minutes at times, So it's very rewarding. Was even more rewarding. Again, it's just the team itself, like the PT, speech, and OT together collectively just make wonders. And when you see your patients progressing,
Mhm.
that alone will just give you the fire. Like, you know what? This is amazing. We can do it. Even if it's just like the simple, like 2 steps. If the patient was never not doing that before and they're able to take 2 steps now, that's huge. So we make a big fuss out of it, like, yes, yes, you did it. It's amazing. So yes,
Yeah,
it's just so
yeah.
rewarding. So at the end of the day, however, I'm tired because it's a lot of physical work. It's very demanding. However, I can be able to go home and say, wow, like this is amazing. Like I really made a difference, not only in the patient lives, but in the family members as well, because they are a huge part of it as well. So
Nice, nice.
yeah.
Well, there you guys have it. I don't know what else we could mention about. I think we really hit like key points on, what's the role of a PTA and the role of a CODA. We work very closely together as was mentioned in this video.
Mhm.
So, Khadija, I just want to thank you for your time, girl. I know you
Yeah.
had a busy day, but you made it on the call, and I really appreciate it. I'm sure everybody out there is going to be having questions and wanting to know more about you. So I really appreciate you. I thank you. And I'm sure we're going to probably catch you sometime again on
Absolutely.
another call. All right.
Yes. Yes. Thank you so much. Good luck.
You're welcome. Thank
Okay.
you.
Thank you. Bye.
Bye.